For the millions of Americans turning 65 this year, navigating Medicare may prove to be unnecessarily difficult. The initial enrollment period is the 3 months before, the month of, and the 3 months after your 65th birthday. Miss your sign up and you start racking up late enrollment penalties and risk gaps in your coverage. Choosing a plan is a big decision, and it is not always an easy one, but you don't have to go it alone.
Medicare isn't one size fits all, and options change yearly. So with many choices, it can be challenging to decide. An unbiased Medicare specialist can help you find the right plan for your health and budget.
Every single year, people's health changes, of course. What most people don't realize is that their healthcare plans can also change every year. And we see oftentimes it's a full-time job for people to navigate those changes alone. We come alongside people completely free of charge, and we help them navigate those really complex changes where they don't make a lot of costly mistakes.
For Exact Medicare, the mission is clear: to ensure that each retiree feels supported and confident in their healthcare decisions.
Exact Medicare was very helpful. They actually take the time to see what you really need and what you can do and what you can afford.
Every single year, inflation is going up, and cost of living for people is becoming really, really challenging. So if we can make cost savings and reduce certain exposures down, such as reducing their maximum out of pocket, their co-insurance, co-payments, those are small, tangible things that can make a huge impact in someone's life, and that's why we're different from the competitors.
If you're considering enrollment, the team at Exact Medicare walks you through every step, ensuring you choose the best plan for your future.
I'm joined by the CEO, Matt Buchan, and co-founder Darren Hacker. Thank you guys for being here with me. So, I don't know who wants to answer this, but as a Medicare provider for many years, when I became a patient, I found it bewildering and confusing. I just imagine it must be incredibly difficult for patients. How do they find the best plan?
That's a great question. Every single day, people are getting bombarded with so many phone calls and solicitation, and it's really hard to know exactly who to trust, how to find the right plan that meets their needs. I think the most important thing in the process is making sure that you're working with someone that's independent, that can look at all the different options in your area to be able to assess. And at the core of that is to be getting to know the client, the shopper, exactly what they're looking for. Because if you don't know the person, it's really hard to pair the perfect plan for them if you don't know the needs of the customer.
Darren, patients tell me they're anxious that an organization like you would cost them money. They're worried about it.
One of the best things about the services that we provide is that there is no cost to them. There is no fee. What the other side of that coin can look like, though, is that by not using and not choosing to work with the right broker and not getting the right type of education and detail and advice behind selecting the right healthcare plan, choosing the wrong plan can prove to be costly. I mean costly.
Costly and disastrous. Because they might have a gap in their coverage, or they fall in the donut hole, or all this things I don't even understand what they are. I've been a provider for 35 years, and I still find it bewildering. How do you review the different options, Medicare options?
Yeah, I think the first thing is you start by working with a broker. So the advantage that we have is that we can pull up every single plan side by side by side. And so we ask questions, what does the doctors look like? What are the medications that you take? What's important to you as an individual? And then, we're not here to ever try to sell a product. We're here to build a relationship with the customers that we service. And so based off of that, we're able to make recommendations based off of their goals, not our goals.
To describe it again, the difference in Medicare, Medicare Advantage.
So Medicare Advantage is going to be, think of it more of a pay-as-you-go type format. So as you need services done, co-payments, go see the doctor and maybe need a knee replacement, you're going to pay as you use the services. And so that's a big difference. Those types of plans have amazing benefits that unfortunately I would say most people don't even know exist, such as transportation to the doctor, such as over-the-counter benefits where they can use it for groceries and pharmacy things. What we see is that if you buy a car, oftentimes people only know that there's drive, park, and reverse, And that's oftentimes with these Advantage plans is that there's all these extra things. It's not just hospitalization coverage. It's covering you from all these what ifs and all these extra things that really make a really big impact on our seniors' lives.
And you had mentioned that you keep your eye on the carriers, and some people may be surprised their carriers go away. That's crazy.
Yeah, and that's what we're seeing nationwide right now. We're seeing, I've heard upwards of 2 million people that are actually losing coverage because carriers are trying to squeeze profit out of areas. And so come January this year, there's going to be a lot of people that are going to be left without coverage. That's why this open enrollment season is really, really important.
How do people connect with you?
Well, I think the easiest way is going to exactmedicare.com.
Okay.
You can give us a call. You can find our number on that way.
And there's no fees.
No fees whatsoever. Yeah, completely free.
That's the
of
part
charge.
that people can't believe.
Yeah.
That you're there to provide a service that might even save them money, definitely save them headaches, definitely improve their coverage or optimize their coverage. No fee to them.
That's what we're here, is to be able to get to know our customers. It's not transactional for us, it's relational. So we really want to make sure that we take care of people and find them the right plan for themselves.
Thank you, guys. I appreciate it. This is an important topic that gets left out of the conversation about medicine sometimes. So I'm so glad we're doing this today. For more information, visit Exact Medicare. It's one word, right?
You got it.
Exact, E-X-A-C-T, exactmedicare.com. Stick around. We'll be right back.